Today, we're going to talk about things you should know before starting myofunctional therapy. Good oral health sometimes requires more attention than just brushing, flossing, and regular dental checkups, which is what I was taught in dental hygiene school. In some cases, more extensive and expensive treatments are necessary, like surgery, implants, or myofunctional therapy. The name may be long and confusing if you don't understand what it means. Last week, we discussed what myofunctional therapy is, what the word means, and how it can impact your daily life. If you'd like to know more, watch that video. Today, we're going to talk about what you should know. Our current healthcare system treats symptoms rather than looking at the root cause. Myofunctional therapy is a specialty that focuses on the tongues, lip, and face for better function and form. It is a treatment often recommended for tongue tie, tongue thrust, sleep apnea, bedwetting, and even jaw pain. However, before diving into this therapy, it's important that you have an understanding of what you're getting yourself into. Symptoms are clues of a bigger underlying issue, mostly involving your airway, how you breathe. That's what we focus on because your airway is your ability to be able to breathe, sleep, function, which is crucial to truly being healthy. Myofunctional therapy is about changing habits and strengthening muscles to improve the way we breathe, eat, swallow, and sleep. Some of the issues we treat may seem normal. However, common does not mean normal. Keep in mind, every patient is different. Some patients may experience jaw pain. Some might suffer from mouth breathing. Some might wet the bed, have night terrors, ADHD. Others might have a tongue thrust or a tongue tie. Their tongue is blocking their airway, or they need a CPAP machine to sleep. Myofunctional therapy is one type of treatment that looks at the way the tongue and other muscles in your face move and function. Just because many people chronically deal with these symptoms doesn't make them normal. Dysfunction is never normal. Our body is really great at compensating. And when something is off, we don't even give it a second thought because our body just does what it needs to help us breathe better, sleep better. But what if you could teach your body, your mouth, your tongue to work for you versus against you? Would you want to do that? When your tongue does not fit or rest on the roof of your mouth, it's not functioning effectively or properly. Whether you realize it or not, it is not correct. You might be asking, why have I never heard of this before? There's no easy answer for this. Even though myofunctional therapy has been around for decades, it's still not widely understood, known, or accepted. And that's because most providers were never trained about myofunctional therapy. I was taught about muscles of the tongue, but not how they should work together, what they should be doing, and what happens if they're not functioning correctly. A lot of times when you don't know about something, you're resistant to it because you don't want to feel stupid. Why? I went down this rabbit hole. Just because I didn't know about it didn't mean it wasn't an effective treatment, which is why I've spent the last 5 years learning about this, becoming a myofunctional therapist and helping others like myself and my daughter. There are so many people out there suffering from these disorders. Knowing that not all providers have the same knowledge will help you make better decisions before choosing therapy and picking a provider that's right for you. This is changing with the whole body approach to healthcare. This is becoming more popular. You're going to hear more people talk about airway and breathing. Suppose you've developed a myofunctional disorder because the natural development of the muscles didn't happen or they were hindered in some way with a chronic habit like thumb sucking, finger sucking, mouth breathing, not chewing enough growing up because our foods are softer, the way you were fed. You may experience problems with eating, chewing, swallowing, breathing. Most children and adults are affected in some way by this disorder. Why should you consider oral myofunctional therapy and what should you know? It's helpful to know these crucial things before starting therapy so that way you get the best benefit and outcome of the treatment. Number one is consultation. A trained provider will be able to identify issues that you have and be able to tailor a treatment plan according to your needs. Number two, knowing what your goals are is going to be important. There are so many symptoms that can be addressed by myofunctional therapy. Do you know why you're going? If you're not sure, it's okay. Your therapist can help you work through that. You don't really need to know why. If you don't feel like you're having symptoms or you don't need it, we don't want to waste your time or your money if this isn't going to benefit you. No one wants to start therapy or think it was a waste of their time or worse, their money. You can do nothing, but you may spend more time and money treating symptoms, which is what I did. So I wish I had known about this sooner, which is why I'm talking about this, because you don't know what you don't know. A lot of times sometimes you're seeking treatment, treating the symptoms, but you're not getting to the underlying cause. So I was treating my bladder, but it was really my tongue and my mouth causing the issues. Once I corrected my tongue posture, my tongue was up, I started breathing through my nose, taping my mouth, I stopped having the bladder issues. So my body was compensating by waking me up to go to the bathroom. 3, it's not just for kids. Everyone can benefit from myofunctional therapy. While it's commonly recommended for children facing developmental challenges with their facial tongue muscles, it's also effective for adults, especially wearing a CPAP machine that you're having issues with. Your kids get it from somewhere, right? So if your kids need it, they got it from one of their parents. Myofunctional therapy understands the reality of the function of your tongue and that it's a dynamic muscle, and that's why it works so well. Next, it's a commitment. Myofunctional therapy requires consistent effort, a time commitment over several months. Typically, it involves regular sessions and doing these exercises every day at home. Making sure that you're prepared for this commitment will make the therapy much easier at the end. You'll get better results and you won't be disappointed. The therapist is there to guide you, but you have to do the work. If you haven't done the exercises for the next therapy session, you can't build on that. So you might have to repeat that week's exercises if you didn't do it, because you won't be able to do the exercises the next week if you can't do the ones from last week. I hope that makes sense. So is treatment going to be convenient for you? Myofunctional therapy is similar to hiring a personal trainer for your body, except for we work below the eyes and above the shoulders. The therapist requires more than one time of working with you. It requires a commitment, and these build on top of one another and make a plan. Many of these therapists do telehealth. Some will see in person. It's 30 to 45 minutes every 2 weeks, but you have to do these consistently. Just like any physical exercises that you have to do or working out, the more you practice, the better the results. It's not a quick fix. Some of these improvements can be noticed rather quickly. I was shocked, but usually takes a longer period of time with sustainable changes, especially if you have an open bite or a tongue thrust, because you have to retrain your brain to use your tongue differently. So it's important that you remain patient and committed throughout the therapy process. Myofunctional therapy can shorten orthodontic treatment. Many adults are looking for straight teeth. Myofunctional therapy exercises along with braces can reduce the time spent in braces altogether, especially if treated early. In addition, the treatments can strengthen the muscles of the tongue, cheek, jaw, making it easier to select different treatment modalities. Like instead of the metal braces, you can wear the removable Invisalign retainers. That's where myofunctional therapy can help with orthodontic treatment and prevent you from relapsing. You'll have to decide what fits best into your lifestyle. If you have a tongue thrust habit, myofunctional therapy can save you from having to wear braces again. Because if you are wearing braces or have worn braces and you have not stopped that habit, your teeth will shift and relapse and you may need to wear braces again. I've seen it happen. I've seen people have to wear braces 2 to 5 times. Myofunctional therapy might prevent you from having to do that. Braces aren't cheap. Your orthodontist isn't going to say, oh, they shifted. We won't charge you to redo that. No, they're going to charge you again. And braces are $6,000. So myofunctional therapy is probably half that. So myofunctional therapy might be beneficial. Myofunctional therapy helps you breathe better. If you're not sleeping well at night, you're kicked out of your sleep cycle, causing you to feel tired, even if you feel like you've had 7 to 8 hours of sleep. Obstructive sleep apnea affects 22 million Americans. Breathing through your nose is going to help you sleep better and keep you out of fight or flight. This can change your life in so many ways. I am feeling more rested and sleeping better, breathing through my nose and taping my mouth. So it was a game changer for me. It can also help improve your appearance. If you frequently breathe through your mouth and you have that habit, it actually alters your appearance. So instead of having a nice jawline, you look more like this, right? You almost look like you have no neck or no chin because of your posture, because you're, trying to keep your tongue out of your airway and breathe better. So myofunctional therapy treatments actually address the root cause of mouth breathing and help you breathe better. The tongue can act like a natural palatal expander and increase your airway because the roof of your mouth is the floor of your nasal sinus. Once you get older, you might need surgery on your nose, on your mouth to widen and open that up, to keep your tongue up in the roof of your mouth. So that's why seeking treatment early is going to be helpful. You want to be able to breathe. If you can't breathe through your nose, think about what that's going to do. Your tongue is going to be down in your airway. Your mouth is going to be open. You're going to be snoring, clenching, grinding, and you're going to, just stand different and breathe different. So it changes the way you look if you're a mouth breather and you can't breathe through your nose. So number 11, This is an interdisciplinary approach. Myofunctional therapy often works in combination with other medical interventions, like I just talked about. Braces can actually widen this and make your bite in alignment. So when you're younger, like when I was younger, a lot of times they pulled teeth and they never replaced it. So the teeth shifted in. It affects your chewing function. When your bite is off, you might only chew on one side because now you don't have teeth on the side. So these muscles are more developed than this side because this side is weaker because you're not chewing on that side and you never replace those teeth. When you're chewing, then you're not able to chew your food as much, or you're chewing with your front teeth. So that's affecting your digestion because of how your alignment is, right? So now your gut health is off. So you can see how important your teeth are to what happens to the rest of your body, because a lot of things go through your mouth. And then insurance coverage is one thing that people ask about. Before you start, you're going to want to inquire into the cost of therapy. It's usually anywhere from $1,200 to $6,000, depending on what's going on, what's being treated, your insurance company, the provider that you choose, and you have to be prepared for possible out-of-pocket expenses. So knowing what your insurance is going to cover, what you're getting into, what your goals are of therapy, what's going to happen is going to save you, not only for myofunctional therapy, but for any medical treatment. So sometimes what your insurance covers is not necessarily what's best for you and your body. Myofunctional therapy is one of those things that generally is not covered under insurance. But I think the time and money that I spent with myofunctional therapy for myself and my daughter was definitely worth it, because it saved me thousands of dollars with the wrong doctor. So let's talk about the 4 goals of myofunctional therapy. Lips together, tongue in the roof of your mouth, breathe through your nose, correct swallow. Knowing why you're seeking treatment, what your goals are, coming up with a plan for myofunctional therapy will increase a positive outcome. Understanding how therapy can benefit you will help you realize the treatment is a remedy for various eating, breathing, sleeping problems. However, the goals and desires of this treatment is sometimes completed with a team, and we all work together for the best outcome for you. Myofunctional therapy has various modalities, and it's effectively increased when you follow through with the program and the protocols to achieve the goals that you want. And the program is set up specifically for you. Understanding the goals and expectations that we are discussing will help you be able to choose a provider that's right for you and your treatment. If you have any questions, feel free to jump on a 10-minute call with me. Click the link below. I do it for free. I can answer your questions. If I'm not the person for you, I can guide you to someone who might be right for you. Myofunctional therapy is a big step towards improving health and function. Understanding these factors will help prepare you of what's involved and help you make an informed decision of what's right for you. The information provided here is for informational purposes only. It's not considered medical advice for your needs, but I do hope that this gives you a better understanding of what to look for with myofunctional therapy, what to expect. I will continue to educate you on the options available to you to prevent disease rather than treat it when it's more expensive. Thank you for taking the time to listening all the way through this. I hope this was helpful. If it is, leave a comment. If there's something you wish I would have talked about, let me know. Subscribe and share if you know someone who could benefit from this. As always, a healthy mouth is a healthy body, and a happy, healthy life. Until next time.